Hello, my name is Luann Back. I'm Assistant Professor and Director of the Institute on Innovative Aging Policy and Practice at the University at Buffalo School of Social Work. I'm here to talk with you today about Medicare Open Enrollment, which began on October 15th and will continue until December 7th. Whether you're a Medicare beneficiary, a caregiver, or a professional who is helping individuals to review their options, this is an important time. Plans change each year. This includes monthly premiums, co-pays, or a beneficiary's share of their prescription drug costs, deductibles, as well as which drugs are covered through your Medicare Part D plan. If you're enrolled in traditional Medicare or a Medicare Advantage plan, this is your opportunity to review options. It's important to take advantage of this open enrollment period. Very few Medicare beneficiaries use this time to switch Medicare Part D plans. However, many individuals can save a substantial amount by reviewing their options. This session will provide tips on Medicare Open Enrollment, as well as give a brief tutorial on how to use Medicare's Plan Finder tool. When considering plan options, this is really the best resource that's available. Some of you may have received information directly from the health plan offering coverage. However, keep in mind that the information is specific to the plan. There are over 40 options available, so it's best to see which is the most affordable plan for your prescription drug needs. Before moving on to our website tutorial, here are a few questions that you should ask yourself. First, what am I paying now, and what will my plan cost next year? This includes my cost of medications, my premium, and my deductible. This information should be in your annual notice of coverage. Will I need prior authorization before my prescriptions are covered? Some plans have what's called prior authorization before they'll provide coverage for certain medications. You'll want to see whether or not these restrictions are within the plan that you're considering. How much will I pay out of pocket before my coverage starts? In other words, what will my deductible be? Most plans have a deductible, and it can range from $0 up to over $300. You'll want to see if there's a deductible in the plan you're considering, and if so, how much is it? Are my drugs on the formulary? All plans have what's called a formulary or a list of covered drugs. You'll want to check that formulary to see if the drugs you're taking will be included in your plan. Finally, if I'm considering a Medicare Advantage health plan, can I choose my primary care physician? Will I be able to use my doctors? Remember, a Medicare Advantage plan is an HMO or a PPO, and there is a list of physicians that do participate. You'll want to see whether or not your current doctor is participating with the plan if it's important that you keep that physician. Also, check whether or not a referral is needed before seeing a specialist. Again, there's usually a list of physicians that participate with these plans, and if it's important that you keep your specialist or specialist, do make sure they participate with your plan before the new year begins. Now, what I'd like us to do is move on to Medicare's Plan Finder tool. As I mentioned, this is really the best resource for finding the plan that meets your drug needs. Website. So we're going to begin by typing that in at the top, and that website is medicare.gov. At the screen, you'll see that we have several options. For today's session, what we'll do is find health and drug plans. So we'll click that option in the center of our screen. Next, we have the option of doing either a general search or a personalized search. If you have your Medicare card handy, you may want to do a personalized search because that will give more specific information based on your current plan. For today's session, though, what we're going to do is a general search. So we'll click on the zip code box and enter a zip code. And then click Find Plans. right, we're now on the page where we enter some basic information. We're first asked, how do you get your Medicare coverage? And you see there's some options here. Original Medicare, Medicare Health Plan, which is a Medicare Advantage plan, or if you don't have Medicare coverage yet or aren't sure, those are options. For today's session, what we'll do is click Original Medicare. And we're also asked if we get help from Medicare or your state paying for drug costs. As you see again, there's several options. For example, if you're receiving Medicaid, you click that option, or if you're receiving Supplemental Security Income, Medicare Savings Program. For today's session, what we'll do is we'll click that we don't have any extra help. And then we're going to continue to plan results. We now have the option of entering our drugs, and this is recommended because what will happen is the plans that are selected for you will be based on your prescription drug needs. So we're going to enter 4 drugs here so that we can get some information. I do want to mention that you do have the option of saving your drug list. So if you're working on your drug list and you want to return to it, you'll want to enter your drug list and the date, and it will give you that option. For today's session, however, we're just going to leave that option alone. We're not going to save our drug list. So we'll begin by entering the name of our first drug. So we'll enter Celebrex in here. So as you see, as I begin typing in my drug, it does give me some options. And I see Celebrex, so I will click on that. I'm then asked for my dose, quantity, and frequency, as well as my pharmacy type. So for today's tutorial, I'm going to leave Celebrex 200 milligram. We will say that we're taking 60 or 2 a day, which is for every 1 month we're receiving 60 pills. And we're going to say we get our drugs from a retail pharmacy. So I'm going to add that list to my drug list. The next drug I'll enter is Lanoxin. Okay, and again, we see that we have the choice of selecting that. This time what we'll do is we'll change our dosage to 0.25. We'll leave our quantity at 1 a day. And again, we're receiving this from a retail pharmacy. We'll add that to our drug list. As we do this, you see that we have an option, that there is a generic available for the drug I selected. So in this case, I'm going to say yes, use that lower cost generic. And I'm going to click Continue. The next drug I'll enter is Fosamax. So I'll start by typing that in, and it is the plus D that I want. So I'm going to select that option. I'm going to leave the dose as it is, as well as the quantity. And again, I'm going to purchase this from a retail pharmacy, so I'm going to add that to my drug list. The final drug that I'll enter is Lipitor. And again, I see that option. Okay. All right, now I have the frequency. So for the dosage, I'll select 40 milligram and we'll say 1 a day, and I'm getting this from a retail pharmacy. So I'm going to add that to my drug list. In this case, again, it's asking me about a lower cost generic. This time I want to keep the brand name. So I'm going to select Use Brand Name Drug, and I'm going to click Continue. Okay, we have all our drugs entered now. And at the bottom of the screen, you'll see your drug list. And these are all the drugs that I entered: the Celebrex, the Digoxin, which was my generic, Fosamax, and Lipitor. You'll see as well that I have the opportunity to change my dose or remove a drug. I'm going to leave my list as it is. But if you were entering this and you realized that you had something that you wanted to change, this is where you could have the opportunity to do so. So I'm going to say that my drug list is complete. I now have the option of choosing my pharmacy, and you'll see that it gave me pharmacies within 1 mile. I'm going to want to broaden that a little, and I'm going to say within 5 miles. So I have several options here. You'll want to make sure that you do select your pharmacies because there are certain pharmacies that do not participate with Medicare Part D. So as you're considering your plan, do make sure that you do add that pharmacy to your list. So I'm going to add CVS, the one on Henrietta, to my list. And I'm also going to add Miller's Pharmacy to my list. So I'll click to re-add those. I'm now ready to continue to my plan results. So I will click that option at the top of my screen. Okay, so as we're at the screen, we do see that we have 47 plans available, which include 26 Medicare prescription drug plans. Those are plans where I would continue with original Medicare and purchase a Medicare prescription drug plan to cover my medications. I also have the option of going into a Medicare Advantage plan, which is also called a Medicare Health Plan. The final option is to look at Medicare Advantage plans without drug coverage. For today's session, what we'll want to do is we'll want to look at those Medicare prescription drug plans, and we'll also want to look at what Medicare Advantage plans may be available. We're now ready to click to continue to our plan results. All right. We're now at the screen that gives us all of our results based on what we entered. So we'll first look at our Medicare drug plans. And again, with this option, I'm going to keep my original Medicare and I'm going to purchase this Medicare prescription drug plan to cover my medications. So this screen really illustrates the importance of doing this search each year. So you'll see the first plan is First United American. And if you look over here at the annual costs, this is what my annual prescription drug costs would be if I was in First United American. Now, as we scroll down our screen, what we see is that the cost of the plan goes up. So if we continue and go down and we look at this AARP plan, you'll see the annual cost is $6,638. Again, this is why it's important that you want to do this search each year because plans change each year. They change their copay or the beneficiary's share of their prescription drug cost, their deductible, as well as their formulary. So what we'll do is we're going to start by selecting our prescription drug plan. So we're going to start by looking at First United. We want to see what that plan looks like. We'll also look at AARP's plan. The other thing is I want to look and see what my Medicare Advantage plan options are. And again, as you do this, be aware that Medicare Advantage plans are PPOs and HMOs. In other words, they have a list of physicians that do participate with the plan. If you're considering enrolling in a Medicare Advantage plan, you'll want to make sure that your doctor participates if this is important to you, as well as whether or not your specialist, or if you have one, do participate with the plan. You'll also want to be aware of what type of copays there are. These plans, as you can see, can result in savings for prescription drugs, but you do want to remember that you're enrolling in this plan and all of your health care will be delivered through that HMO or PPO. So the first plan we're going to look at is the Medicare Blue Choice, which is an HMO. So we're going to click that option so we can see what that plan looks like. We're now ready to compare plans. So we will click on Compare Plan Options so we can see what these plans actually look like. All right, on the screen you do see your choices that you clicked. We have our Medicare Blue Choice, we have First United and AARP. Now, just as a reminder, the First United and AARP, these are prescription drug plans. These are standalone PDPs, prescription drug plans. You'll maintain original Medicare if you enroll in this option. Medicare Blue Choice is an HMO. So again, you'll want to be sure if your physician, if your specialist participates with the plan, if this is important to you before enrolling, as well as be aware of what the copays are for other medical services. So as we scroll down our screen, we have our comparison. We see that the Medicare Blue Choice, there is no premium to enroll in this plan, so there is no monthly premium that the beneficiary would pay if they chose to go in this plan. Also, as we look, there is no deductible before the prescription drugs are covered. In comparison, First United and AARP, both of these plans do have a monthly premium. For First United, that would be $67.60, and from AARP, that's $101. First United as well does have an annual deductible, which is $120. In other words, you would pay $120 of your drug costs before the plan would begin providing coverage. For AARP, there is no deductible. As we continue to scroll down our screen, with our first option, if we were to enroll in January, the cost would be $2,977 for our drugs for the entire year. At Miller's Pharmacy, it would be a little bit less. The first comparison was for CVS, next was for Miller's. Finally, if we went with a mail order option, it would be a little bit less. Similarly, for our two PDPs, it does show us what those annual costs would be. For our First United, it's $3,668 at CVS. And for AARP, it's $4,181.23. Again, there's also the comparison for Miller's and mail order. As we continue to scroll down our screen, what we receive is a monthly breakdown of costs. So with our first plan, as you see, your monthly cost would be $290 for your medications. Once the coverage gap or the donut hole is reached, the plan costs do go up, or your prescription drug plan costs would go up under the plan. In other words, once that donut hole is reached in May, my costs would be $370 a month. After the 10th month, or in October, this is when the catastrophic level is reached. In other words, the drug costs will drop because I am at that catastrophic level. There are similar comparisons for both the PDP at the final two columns. In other words, if we look at our First United, we can see our monthly breakdown. We can see when the donut hole is reached, which is when the drug costs do and continue go up a bit. And then finally, the catastrophic level. The AARP, again, we have our monthly breakdown. This would be January, February, March, and April. We'll reach our donut hole in May, and the costs will go up. And actually, September here is when we will reach the catastrophic level, and for the remainder of the year, the costs would be about $138. The final thing that I do want to point out on this screen is, as I mentioned in my overview, some plans do require prior authorization. They also do have certain restrictions in place. So this part of our screen here, the drug coverage information, will give me a comparison of what those restrictions may be. It'll also tell me if it has quantity limits, as well as whether or not my drugs are covered. So in all three plans, as you can see, Celebrex is covered. But it does have what's called step therapy. And if I wanted to learn more about this, I'd click on the little question mark, and it'll give me a description of what step therapy is. In this case, what it tells me is I may need to try a different drug first before my drug will be covered. So you want to be aware again whether or not your plan has that restriction in place. We're going to close this window. And we'll look and see as well, with our HMO plan, there are also quantity limits in place. The other two plans, as we look at our First United, it requires step therapy. However, with AARP, there are no restrictions. The drug is simply covered. For all three plans, there are no restrictions for digoxin. As we look at our Fosamax, you'll see that all plans have step therapy in place. The first two plans as well have quantity limits, so you'll want to be aware of what that looks like. And I can find out what those quantity limits are by simply clicking the little option there, and it will give me a screen that tells me about what those quantity limits are. We'll close that screen by clicking our arrow. Finally, Lipitor. Again, our first two plans have step therapy and quantity limits, and our final plan with AARP has no restrictions, and it's a non-preferred brand name, which means it's covered. Okay, what you'll want to be aware of as well is once you're done with this, with your search, you have the option of enrolling right within the plan from your screen. So if you're looking at this, you decide you like one of the plans, all you need to do is click enroll. We're not going to do that for the purposes of today's tutorial, and it will give you the ability to enroll in the plan. Finally, be aware of whatever choice you make. Coverage will begin on January 1st, 2014 and will remain in effect for the entire year. So whatever option you choose, that will remain in effect for next year. That will conclude our tutorial for today, as well as our session on some of the basics about Medicare Open Enrollment. I hope you found this information helpful. Thank you for participating.